Assalamu alaikum. Welcome back to my YouTube channel. I hope you are fine. In this video, I have covered 30 important medical and surgical nursing MCQs. So if you are new in my channel, then don't forget to like, share and subscribe. So without wasting time, let's get started. What is the normal range for potassium in the blood? Right answer is option B, 3.5 to 5. Which condition is characterized by the inflammation of the appendix? Right answer is option B, appendicitis. Which heart sound is associated with the closure of the mitral and tricuspid valves? Right answer is option A, S1. What is the primary action of insulin in the body? Right answer is option B, decrease blood glucose levels. Which electrolyte imbalance is associated with scholastic and tertiary signs? Right answer is option B, hypoglycemia. What is the main purpose of diuretic in patients with heart failure? Right answer is option B, reduce fluid overload. Which organ is primarily affected by cirrhosis? Right answer is option C, liver. In ECG interpretation, which interval represents the time from ventricular depolarization to repolarization? Right answer is option C, QT interval. What is the primary nursing intervention for a patient with a blood glucose level of 50? Right answer is option B, provide glucose immediately. Which drug is commonly used to treat acute myocardial infarction? Right answer is option B, aspirin. In a patient with dehydration, which lab result is most likely to be elevated? Right answer is option B, blood urea nitrogen. The main sign of fluid overload in patients with heart failure is. Right answer is option C, edema. Which diagnostic test is used to measure the function of the kidneys? Right answer is option A, serum creatinine. What is the typical cause of angina pectoris? Right answer is option D, reduced blood flow to heart muscles. Which symptom is most indicative of a urinary tract infection, UTI? Right answer is option C, dysuria. Which medication is used to treat hypothyroidism? Right answer is option B, levothyroxine. A high fever and sore throat in a chemotherapy patient could indicate. Right answer is option A, neutropenia. Which surgical procedure is commonly used for gallstone removal? Right answer is option A, cholecystectomy. Which sign is typical of deep vein thrombosis? Right answer is option B, erythema and warmth in the leg. What is the major function of platelets? Right answer is option C, clotting. The most important post-operative care measure for a patient after abdominal surgery is. Right answer is option B, encouraging deep breathing and coughing. The characteristic symptom of hypothyroidism is. Right answer is option C, heat intolerance. Which of the following is a symptom of diabetic ketoacidosis? Right answer is option B, fruity breath odor. What is a priority nursing intervention for a patient experiencing a seizure? Right answer is option B. Protect the patient from injury. Which laboratory value is the most reliable indicator of myocardial damage? Right answer is option B. Cardiac troponin. What is the common symptom of peptic ulcer disease? Right answer is option C. Epigastric pain. Which of the following signs indicates hypoglycemia? Right answer is option B. Shakiness. The treatment of choice for anaphylaxis is. Right answer is option B. Epinephrine. Which of the following is the best indicator of fluid balance in a patient? Right answer is option C. Daily weight. In a patient with COPD, what is the primary goal of oxygen therapy? Right answer is option D. If you like the video, then share it with your friends.